everyone, thanks for coming. We are here to talk about Mrs. Anderson. Peggy Anderson is a 36-year-old female bank manager. She was diagnosed with an inoperable tumor in the left lateral aspect of the pons, the medulla, and in recent weeks she has reported difficulty with speech and swallowing. While she consumes a diet of regular foods and thin liquids, she reports coughing while eating and drinking. And despite these difficulties with eating, her respiration is within normal limits. During the language and cognitive exam, she had moderate auditory comprehension skills and good repetition skills, which are important to note. She presented with emotional lability and frequent perseverations, and her verbal fluency was an average of 7 words. She demonstrated anomia and semantic paraphasias. An example of this would be spoon for fork. And lastly, she demonstrated deficits in semantic, episodic, implicit, and working memory as well. And based on these characteristics, Mrs. Anderson presents with thalamic aphasia, cognitive deficits, and moderate to severe dysarthria.
Based on assessment results, patient report, and clinician observations, it is recommended that Mrs. Anderson receive speech-language therapy targeting the areas of short and long-term memory, speech rate and intelligibility, auditory comprehension, anomia, perseveration, semantic paraphasias, and verbal fluency. The primary target of treatment should be memory deficits. We prioritize memory due to the fact that memory deficits may have the most adverse effect on our occupational performance and overall quality of life. Another focus should be Mrs. Anderson's speech rate and intelligibility to optimize communication skills. Her ability to communicate will impact her quality of life in relation to safety as well as her social life. Auditory comprehension should be targeted in therapy as well because of its importance in communication and interactions with others, both at home and at work. 2 intervention plans that could be beneficial for Mrs. Anderson include space retrieval therapy and Schul stimulation approach.
Space retrieval is an evidence-based memory treatment option that activates a patient's procedural memory and uses it to help them relearn how to retain and recall important information in short-term and then in long-term memory. Memory targets can range from personal information, such as family members' names, or safety information, such as remembering to turn off the stove. It is an effective method of treatment for those with Alzheimer's, dementia, TBI, and aphasia.
Our second intervention was Schul's stimulation approach. This is one that utilizes intensive auditory stimulation to optimize the patient's language abilities. It's been advocated by researchers since the 1960s. This is when the clinician is frequently stimulating the patient's auditory system, and it's believed to be beneficial because auditory stimulation impacts brain activity, therefore having the ability to have an effect on structures and functions of the brain. So with this, the neuronal fibers are being activated more frequently, which positively influences the brain activity and the function. And implementation of this program includes having the client do tasks such as pointing to objects, following directions, and accurately responding to questions.
So both interventions are both evidence-based, and they both do not focus on teaching new language skills or cognitive skills, but utilizing previously learned language and cognitive skills during the therapy process. Other than these 2 characteristics, there is not a lot of similarities between the 2 due to one focusing more on memory and one focusing more on language. The target population for both interventions is different. Space retrieval is more of targeted towards people with memory difficulties, while Schul stimulation approach is targeting people with auditory comprehension deficits associated with aphasia, but it does have elements of memory and recall that can be scaffolded depending on the severity of the aphasia. And protocol-wise, space retrieval therapy has a very specific protocol for how to adjust stimuli based on client response, so this can mean adjusting the type and the amount of time in between stimuli, as well. And in contrast, Schul's stimulation approach has a greater number of options based on client needs, so we concluded that 3 areas that could be targeted with Mrs. Anderson could be response switching, which would assist her auditory comprehension in relation to her occupation, sentence completion to address her anomic difficulties, as well as WH questions to practice questions that may arise in her personal and professional daily activities. Thank you all for coming.
Hi everyone, thanks for coming. We are here to talk about... Hi everyone, we're here to talk about